has been lifted. Now, across the world, the wearing of face masks have been mandatory, including here in South Africa. Not everyone is wearing them, though, including some world leaders. So let's remind you tonight why wearing masks has been deemed so important in the fight against COVID-19. To discuss, we're joined by Dr. April Baller, medical officer from the World Health Organization's Health Emergencies program. She joins us tonight from Geneva in Switzerland. Doctor, thank you very much for joining us. I think there was some confusion originally in the early months with the advice being wear it only if you're symptomatic, but the World Health Organization deems this very important now after looking at the facts. Just tell us why.
So thank you very much for this opportunity. It's a great pleasure to be here with you. I lost the last bit of your question.
Why, just generally, why is it so important is in the eyes of the WHO to wear masks?
Okay, great. So firstly, just to emphasize that the wearing of mask is part of a comprehensive package, which includes maintaining the physical distancing, hand hygiene, and many of the other important components. So medical mask by itself is not the answer to everything, but it is very important. So what does the mask do? Depending on the type of mask that one uses, there are medical masks, surgical masks, and now they're called cloth mask or face coverings. They act as a barrier, and they can either protect the wearer if the wearer is not infected from getting infected from someone else. So they can be a source of prevention, and they can also be a source of what we call source control. So if the wearer is sick and has symptoms and is coughing, and there are droplets, then it also acts as a barrier from the person who already is sick to pass it on to someone else. So it's both as a prevention and a source control. And in many countries already, it is already being used in the fabric mask are being used as a source control. So in other words, saying, if I wear a mask, I protect you. So this is really the fundamental kind of function of the mask. And what we have now that's very new and interesting, new research that has come through is on different types of mask. Before, there was always certainty around the surgical medical mask, which is the one that everybody recognizes, which is usually blue on the outside, or even the respirators, which are the big the ones that have like a half cup. However, now there's new research that has come out that was requested by WHO through several research groups. And what it does is that it looks at the non-medical mask. The cloth mask is called, and now it's going to be termed the fabric mask. So this fabric has been looked at, and all the different types of materials that are used to make the fabric mask. And what the research is showing is that it does provide a barrier. The level of the barrier that it provides varies on the type of material that's used. It can be from cotton, polyester, synthetic, or polypropylene, or nylon. So this is really a great tool, new tool that now the public health world and also the governments have in their toolkit, in the sense that they can now encourage their citizens in places where there is active community widespread transmission, and it's not possible to actually maintain some of the physical distancing. I was just watching what you were showing before about the protest, and also understanding many of the context in many urban settings where it's difficult to maintain the physical distance. The mask then is a barrier between whoever's wearing it, the other people around them, when they are in close contact.
Well, I mean, what sort of difference does this make? You were talking about those demonstrators in Washington, for example. So they're pretty close, but they're all wearing masks. If someone with the disease wears a mask, to what extent does that stop others from getting it?
Yeah, it's a very good question. And the data doesn't tell us, what's come out, how how much does it actually do that? But we do know that it provides the barrier. The data that's come out, the evidence has come out, is that these materials now do provide that barrier. It's a filter. And the important thing is that when people wear it, what's come out in the guidance is that it's not enough just to wear one piece of material. It's also the combination of materials that is used. It's how it's worn, and all of these things together are something that will provide that barrier. So, and with respect to that, just quickly to go on to the mask itself, when it is actually made, ideally it should have 3 layers. It should have an outer layer, which is basically water resistant, so that water doesn't come into the mask. It should have an inner layer, which is water absorbent, like cotton, so that absorbs whatever's coming out from somebody's mouth if they're coughing or anything like that. And then the mid layer, which should be a filter, which is usually polypropylene. And by having that, then the person can feel more confident that it is something that is providing that source control or that barrier between them and the other persons around them. But it is very important to emphasize that for the protection, really right now, the standards that are in place are with respect to the medical mask or surgical mask. Those are the ones that provide protection for somebody who's not ill to somebody who may be ill. So it's a whole spectrum of barrier that's required.
In South Africa, the advice, I think, is to wear at least 2 layers of cloth. So at least you will get some protection. It may not have the 3 layers, it may not have the waterproof outer covering, but wearing 2 layers at least will make a difference, right, Doctor?
Yes. Once again, thank you for the good question. And this is new science for everybody. So we're all learning, and that's why these guidance is coming out as well, which gives almost like instructions on the types of materials that can be used. So it depends on which material they're using. Something like cotton does have a level of filter. The challenge with it is that it's absorbent to water. So what happens then is that, once the mask becomes wet, or it becomes dirty, which can happen, then it should be taken off and it should be replaced. So the 2 layers is fine, but it depends. I mean, ideally, that's why we say the 3 layers, so it has all of the components that we were talking about previously. And that the important thing to note is that it should, if it becomes wet or moist, it needs to be removed and it needs to be replaced. The other thing that's very important with the mask is that it should be very tightly fit around the face and not have any air that's coming through between the mask and the face.
And then finally, Doctor, tell us about the wearing of masks. If you're not a healthcare professional, you're just wearing the cloth mask. We see a lot of people just get hot, or they want to drink something or eat something and put it down, and then you have to lift it up again. Just give us some guidelines there.
Yeah. Thank you for that very important question. So what the guidance or the instructions are saying now is that preferably somebody should take the mask. When they take the mask off, they should actually put it inside a resealable clean bag. And they should first, before they take it off, they should wash their hands either with soap and water, or they can use alcohol-based hand rub. Then they put the mask inside the sealable bag, and then they should again wash their hands before they eat, and then once again when they finish eating, before they put the mask back on. The other suggestion is that the mask should only be used for 1 day at most, and at the end of the day it needs to be washed and before it's put on again, washed obviously and dried before it's put on again the next day. The advantage of using these fabric masks obviously is that they are reusable. They're also something that gives people, causes much less waste in the community. And the third thing is that it gives people some sense of, should we say, like a community, because a lot of different people are wearing it. And finally, it can also be a source of income for some people. So it definitely has its advantages. And now with this new evidence, we have more confidence in suggesting that it's something that's used. But once again, just to remember that this is part of a comprehensive package. It cannot work on its own, and there are certain times when it should be used. The most important preventative measure still remains maintaining the physical distance where that is feasible and the frequent washing of hands.
Thank you so much. The latest guidelines from the WHO. That was Dr. April Balla, Medical Officer from the World Health Organization's Health Emergencies Program.